You may not have known this, but June is Men's Health Month. So we want to use this opportunity to really talk about some of the things that men can do to be healthier, even live longer. Brad Biskup is a physician assistant with the Calhoun Cardiology Center at UConn Health. He joins me now. Good morning to you.
Good morning.
Thanks for coming in. This is something that is worth talking about because, guys, you're not doing the best job when it comes to taking care of your health, right?
Yes, that's exactly right.
And preventive health, how are they doing in that department?
Not very well at all.
Yeah.
In general, the American population, both men and women, don't really assume responsibility. When you think of the risk of heart disease or overall disease, 70 to 90% is preventable if we just kind of take into consideration what we do with our diet, our exercise, stress management, tobacco use. So that has a huge impact.
Okay, and I'm not pitting the sexes against each other, but women are faring much, much better and living longer as a result. Why is that? Why from infancy to adulthood are women basically healthier?
If you think of men in general, they get into their work, they're working these long hours, which women are doing, but women have a better, I don't know, they just really look and fit in activities, doing things, the social support. So
maybe we multitask better?
I won't say yes or no, but those are the little
really
things
stirring
you
the pot.
really, but looking at chances for activity. You know, it's women, you know, doing things with groups. Men, it doesn't seem like they have more excuses.
So what are some worrisome things then? Like what are some things that are really on a man's potential radar screen eventually health-wise?
Well, if you look at the risk of cardiovascular disease, that's the number one thing that kills men. And if we think of what they can do, number one, eating healthier.
Yeah.
More fruits, vegetables, nuts are very important. Non-processed foods, just starting with that.
Yes.
Trying to fit in more activity, could be a 30-minute walk 3 days a week. You know, we always look at the guidelines, and the guidelines say you have to do this. 30 minutes 5 days a week, but it's really hard for people to find the time, and they think of it as all or none instead of just, okay, I'll get 3 days in.
How big a deal is tobacco use when it comes to health?
It's huge.
Yeah.
Overall, because it's pro-inflammatory, you know, as we usually think of, you know, with the lung cancer, but overall cancer risk, overall cardiovascular disease, because it's very pro-inflammatory for the body. And that's one thing, again, setting yourself up, because basically 1 in 5 people still smoke.
I'm surprised to hear the numbers that big. Both sexes, men and women?
Fairly
That is really surprising. Obviously, we've gotten a lot better, but we still have a way to go.
Yes.
If there's something that a man out there listening, boy, anyone, could really take away and perhaps do today to get on the right track or change their health if they think, you know, I'm sitting here and maybe I'm a bit of a couch potato, I'm off track, what would the one thing you would really recommend to them to make a change be?
One thing, don't focus on weight. We're terrible about focusing on weight as the end point. But, you know, looking at what am I eating? Am I eating, you know, am I getting 2 pieces of fruit a day?
Right.
Making little changes. You know, am I getting a half cup of nuts per day? You know, I love nuts, I love fruit, I love avocados. And they're not taking the opportunity of eating the things that they like that are good for them. And moving more. You know, wearing a pedometer, being creative in how you can, yeah, exactly. Find things that are going to motivate you to move more. And stress is also very important. Being able to work with people in your family during stressful situations, knowing that you have the support of the family, and working together.
Well, we love our guys and we want to save their lives and have them live as long as possible. So, Brad, really good information. Thanks so much for coming in.
Thank you for having me.
One of our favorite guys around here is Bob Maxon.